Why do people use drugs? Usually it's because they're in pain. Be it physical pain, be it emotional pain, be it depression, that often leads to them using drugs to escape. By escaping, even if they're using in the very beginning when they're using a drug and they're not totally addicted, they have complete control over whether they use that drug. The way addiction takes place is that somebody may start out innocently using a drug that's been prescribed to them, and then because they start to overuse the drug, they become addicted to it. They don't have the voluntary control that they had in the very beginning, and now it's out of their hands. That's the way they feel, because all that's driving them at that point is the fact that they have this very strong craving, so they need to get the drug. And that often leads to, unfortunately, some type of criminal act or acquiring a drug that may not be the opioid prescription that was given to them by their doctor, but may be heroin, which can take the place of that, and it's also easier to get and cheaper to get. Once you're addicted to a substance, your decision-making process is not as clear, it's not as rational, and you are only looking to satisfy that craving. So if that means that you have to commit a crime in order to get the drug, in order to satisfy that craving, that's what you do. And that's when you become part of the criminal justice population. There are different components of entry. There is when the person's arrested, prosecution, adjudication, sentencing, corrections, and also when the person returns to the community. And they offer opportunities to become engaged with the criminal justice system and identify those who are in need of treatment and the best vehicle for it. It's not just the judge or the prosecutor or the defense attorney that's involved. You also have the clinician that's involved. You also have an advocacy group that usually plays a role in providing support and the wraparound services that are required to make sure that that person is successful in dealing with their addiction. The offender reentry program and medication-assisted treatment can work together to assist the individual that's returning to the community. They're often returning to communities that are underserved, that are at risk, that don't have access to the resources that many people who have a substance use disorder need to help them to deal with their addiction. The lack of community resources plays a critical role when it comes to drug use and addiction. That's one of the reasons why it's been so tough to deal with this issue. In many communities, especially when it comes to rural communities, there are not as many opioid treatment programs available. There is difficulty in even gaining access to these resources just because of the way the communities are spread out. There's often a stigma associated with it, so people don't want others to even know that they're addicted to the drug. And in a number of cases, there are providers that are not available who even know how to deal with that issue. Many of these individuals are returning to the same communities that encouraged them, supported them in using a drug in the first place. We want to make sure we provide the resources that people need when it comes to their addiction so that they don't relapse and return to prison.